Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Going to be speaking with returning guest Dr. Gary Lelly. He's joining us again from Weill Cornell Medical College, and he's joining us to talk about Thyroid Eye Disease Awareness Week that was held November the 16th through the 20th. That week aimed to advocate for awareness and education for this very serious, progressive, vision-threatening rare autoimmune disease. Welcome back to Health Professional Radio, Dr. Gary Lelly.
Thanks so much, Neil. Pleasure to be with you.
Well, for our listeners who may not be familiar with you, when you were here before, give us a bit of your background and talk about your role there at Weill Cornell Medical College.
Sure. I serve as vice chair for our Department of Ophthalmology, and I direct the oculoplastic service, which is a small subspecialty within ophthalmology that deals with diseases that occur around the eyes, so in the eyelids, the orbit, the area behind the eyes, and the tear duct system. And that's kind of where thyroid eye disease comes in, because it affects the tissues predominantly around the eyes by this progressive inflammatory, changes that occur in that area.
What are the symptoms that we would look for to make sure that it's TED and not something totally unrelated?
Yep. Well, the first thing is, thyroid eye disease tends to occur in patients who have Graves' disease or some thyroid abnormality. It can actually occur very rarely in patients with normal thyroid levels, but most often occurs in conjunction with Graves' hyperthyroidism. And so for patients who have Graves, they need to be extra mindful of their eyes. The types of things that they're going to watch out for are swelling around the eyes, the eyelids retracting, basically pulling away from the colored part of the eye. So you start to see this bulging appearance to the eyes. And the eyes can actually push out of the eye sockets. When the inflammation affects the muscles behind the eyes, in about half of patients, the eyes don't line up well or move well anymore, and patients may experience double vision. The eyes get red, irritated, inflamed, and dry from the fact that there's more air exposed to the eye surface, drying them out. So patients are going to have foreign body sensation, blurry vision, discomfort, those types of things.
Now, aside from the obvious eye discomfort, are we talking about headaches that are caused by this condition as well?
You can. The more common thing is actually eye pain or pain around the eyes. In fact, one of the most common ways patients will describe this is that they used to not be aware that their eyes were there, and now they just have this dull ache around the eyes or discomfort when they move the eyes.
Now, is this something that is going to have to be just dealt with, this inflammation? Does it come in cycles? How exactly does TED affect the quality of life other than the obvious?
Right. So it goes through really a progressive inflammatory phase that typically lasts about 2 to 3 years in patients. It tends to last longer in those patients who smoke. And during that time, the conditions may often worsen, the discomfort, all the things we just discussed. And it'll also fluctuate quite significantly. Eventually, the disease somewhat stabilizes, but in the past, patients were left with a lot of negative sequelae of the disease after that 2 to 3 year mark. And so in terms of quality of life, it affects their function. They can't see well. They have double vision. They're uncomfortable. And so things like watching TV, working on a computer, driving, all can become issues. But psychosocially, it also affects them because the most common age, the most common demographic of these patients is females in about their 40s. And so they go through this really drastic change in their appearance and function. And so they become oftentimes depressed or anxious or avoid social interactions because of this drastic change in the way they appear. And so, we have to be mindful that it's really affecting them psychologically as well.
How does the stigma of this condition affect how the conversation between the patient and the physician is facilitated?
Yeah, that's a great question, Neil. I think the physicians need to understand that the patients may be remiss to tell you how this is affecting them from a psychosocial perspective. And so I think the onus is on the physician to ask the patient to draw that out from the patient, not just focusing on, the metrics that as doctors we love, measurements, visual acuity, how far out the eyes are bulging. These are all numeric data that we can get, but then just taking a step back and asking the patient, how are you doing? Is this affecting your work? Is this affecting your social life, your marriage? These types of things. I think the onus is on us because they may not bring it up. They're oftentimes either shy or embarrassed to bring these types of things up.
What about proper diagnosis? Is this something that is easily diagnosed, or do patients historically get a hit and miss before they're properly diagnosed?
A lot of times it's a hit and miss because this, in many people, in many physicians' eyes, what'll happen is, they'll see somebody, the eyes will be red, they'll be dry, and they'll just diagnose them with a much more common condition like dry eyes or allergies. You really have to put the puzzle together, in conjunction with the thyroid imbalance and also the telltale signs of eyelid retraction, exophthalmos, or the eyes bulging out, double vision. These things really, occur with thyroid eye disease. And once you're accustomed to making the diagnosis, it's a diagnosis you can make as you walk into the exam room because there's a classic appearance to the disease. But they're often misdiagnosed a few times before they find their hands into the right specialists. And just to reiterate, those specialists are usually ophthalmologists who are subspecialty trained either in oculoplastic surgery or neuro-ophthalmology. Certainly other types of specialists evaluate this disease, but those are the real subspecialists on it.
What about the go-to treatments?
Yes. So, step one in terms of treatment is diagnosis. So get these patients in early. And then we do things to make their symptoms better. So we treat dry eyes in our standard fashion with eye drops or even medicated drops. We recommend that they stop smoking. If they are smokers, avoid secondhand smoke. We treat them with an antioxidant called selenium for 6 months, which has been shown to decrease the severity of the disease and such in a large study published in the New England Journal of Medicine. And then we classify them into sort of groups of severity, mild, moderate, or severe. For those patients who hit the moderate or severe levels, we consider additional treatment. We have a new FDA-approved drug, Tepezza, which is a monoclonal antibody and infusion that has worked extremely well in these patients with moderate and severe disease. There are 2 large, well-done studies published in the New England Journal of Medicine in 2017 and 2020, and this is a new thing. This is a new drug that we just started using this year. And so we'll treat patients in those categories with Tepezza, and that's generally been well tolerated with really excellent results. Down the road, some patients do need surgical intervention. We usually like to reserve that for patients who have kind of gone through the progressive phase of the disease and then need some surgical rehabilitation, either to bring the eyes back in the eye socket. Those are things called orbital decompression surgeries, or fixing the double vision. That's called strabismus surgery. And then the last step in the process is eyelid surgeries to address the eyelid retraction. So, it's been a real paradigm shift for these moderate and severe patients since the FDA approval of Tepezza. In the past, we had this sort of watch and wait mentality as the patients went through the progressive phase of the disease. Now we have something to offer them and to help them get back to functioning in a much quicker fashion.
Well, Gary, that's a lot of information to take in. Let's talk about the TED Awareness Week that was held November the 16th through the 20th, and talk about some of the activities that were held throughout that week.
Yes, thanks, Neil. It was a great week to bring awareness to thyroid eye disease, to just try to get the word out that this disease exists, and we want patients and providers to know about it. One thing that was launched during that week was a daily show, TED Today. The platform for that is on the Listen to Your Eyes Facebook page, and that's bringing together providers, patients, important content to understand the disease better, to know what it's like to have the disease, to know about treatment options for the disease. So that was launched during our Thyroid Eye Disease Awareness Week. Also have a great website that I'd love to plug, thyroideyes.com, where patients and even providers can go to learn more about the disease, and importantly, to find a specialist in your area. You have the ability to basically type a zip code in and find specialists who understand thyroid eye disease. So, through that week and through doing interviews like this with you, we're just trying to get the word out to as many people as possible about this really important autoimmune disease that we don't want it to go unrecognized any longer.
Well, Gary, I appreciate you joining us here on Health Professional Radio again. Always a pleasure, and I'm looking forward to our next conversation.
Sounds great, Neil. Thanks so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.